Okay, if you soaked up a little too much sun this summer, there's a way to repair some of that damage. Here with a closer look at DIY treatments is dermatologist Dr. Sherry Ingraham. Good morning to you.
Good morning.
And you brought in a patient who's going to help us out here this morning as well.
Yes.
Welcome to you as well. Okay, so let's talk about the guys this time.
Sure. So guys' skin is a little different. They're lucky. They've got thicker skin. They've got more collagen. They have thicker stratum corneum, which is that very outer layer of the skin. So they age a little differently in that they're a little bit more prepared for sun damage. However, men wear less sunscreen. Men aren't good about using products. So we need to spend a little more time educating them. And then there's some home things they can do to catch up with
Show us some of the home things. You got a couple little devices.
So there's a great new device, Clarisonic, which we've had for years, which has been more of on a wand, which more women tend to use. Well, now they have one called the Alpha Fit for men. This is an awesome device. I'll let Joe show you. A man can do this once or twice a day. It's going to stimulate new collagen production. It's going to break up some of the dirt and grime that collects in our cells and overall give them a clearer, smoother collection of skin over time, but also allow them to get a smoother shave.
What does that feel like on your face right now?
Feels like it's exfoliating.
Does it? Yeah. So is it sort
Feels like it's cleaning.
It does, so you can actually feel that.
Yeah, ideally you'd use it with soap and water in the shower, and the cool thing is it keeps its charge for days, so you can keep it in the shower. If you travel, you can throw it in your bag and go. We also like for men this Tria home laser. So unlike what you would get in a doctor's office and pay anywhere from, you know, $300–400 for a clear and brilliant treatment to perhaps $1,000 for a Fraxel laser, this is what I call a mini diode laser. So you can actually do this at home every single day, and what it does is it pokes hundreds and hundreds of fine little holes in the skin, stimulating new collagen to grow, and that'll reverse some summer sun damage and help lighten up dark spots.
And you just ran that over your face, so it's pretty simple. Now, but we're talking about poking 100 holes. It sounds painful. What did it feel like?
It's not painful at all.
It doesn't feel like.
No, compared to what you would do in the office, it's a very light treatment. The nice thing is you'd go back and you would apply your topical antioxidant. So I always tell patients the most important thing, sunscreen and antioxidants. Men are the hardest group of people to get using these products, but if we can get them in the thought process of applying an antioxidant to their face at night, especially after you use one of these devices, you can reverse that summer sun damage.
So you can actually see a difference. Not only are you preventing, you will see a big difference. What else did you bring in? We got our we know sunscreens.
We've got our sunscreens, newer sunscreens on the market now. I love this line from La Roche because it contains antioxidants. Not only do you have your sunscreen, but you have those vitamins you need. And then even more exciting are our antioxidant sunscreen pills. So this is HelioCare. It gives your body an internal SPF of about 8.
Really?
So if you're a man,
you take a pill?
You take a pill. If you're a man, you sweat a lot, your sunscreen comes off, we still want you to apply it, but you take one every single morning. If you're going to be out golfing, playing tennis, at the beach, take a second one at noon. Once you get into the habit of taking this every day with your vitamins, it can really help with anti-aging and prevention of brown spots and sun damage.
I had to ask you, would you be more willing to just pop a pill for your sunscreen than actually slather it from head to toe?
For me, I have to do both.
Really?
Yeah.
So you would
So
do
I'm pretty fair-skinned.
Right. Yeah. Okay. Well, interesting stuff. There you go. The guys are going to be looking really good.
They are.
All right, Dr. Ingraham, thank you so much. Appreciate you coming in.
Thank you.
Thanks.